I'm Susan Findlay, and welcome to the Massage Warehouse video series. I'm very pleased to be here with you, and I hope you join me in the upcoming videos that we've got. Now, a little bit about me, just a short, quick window into what my background is. I am the director of the North London School of Sports Massage. As well, I specialize in oncology massage and teach accordingly. Some of you might have been watching my Massage Monday videos, which are free and delivered to your inbox every week. And you're more than welcome to go find those online. Otherwise, let's get on with some of these vids. In this particular video today, we're going to talk about interviewing a client. Now you will see in the video that I do not have a notepad, a pen at the ready. Instead, I am literally absorbing into talking to a client face to face without anything else around. If I have something important that I need to write down, i.e. some dates or surgery or medication, that I will write that down on my sheet. However, at this point, what I find useful is that you are able to develop the relationship without the interference of looking down and then watching you write things down. So see how you go. It's easy enough to remember someone's story. It's just the things like names and dates and things that are need some help with what you're doing. And also, by the end of the session, I've reorganized how their history has gone. It's quite often delivered initially in a kind of convoluted way. So give it a shout, practice it with friends and family, and see how well you get on. See you soon. So I'm here with Rachel today, and we're going to do a sort of a spontaneous case study. I've not met her before, so I don't know what her historical background is. So I'm going to take you through the process I usually go through, which is to do a fairly short verbal, because most of the stuff that I find out is through my hands. And that's when I have the conversation with my clients, is as I am working through my touch and movement is where I get my best information. So for the purpose of this video, I'm going to do a little bit more extensive assessment, verbal assessment, than I normally would do in real life. So thank you, Rachel, for coming in today. So what would be, if you were coming in to see a therapist, what would be your priority? What would be your number one thing you would be coming in to see them for?
Okay. Well, I have back pain on both these sides. It kind of starts all the way at my neck and goes all the way to my spine, so to the bottom of it. So that would be my biggest priority, kind of sort that out. Today, my shoulder, this area of my back is really hurting.
Okay. Now, has that been around for a fairly long time?
Yeah, I've had this pain like really bad for about 5 years now.
When you say pain, how would you describe it?
It's always there. So it's just like a constant pain, kind of like a dull aching. Sometimes it could feel like somebody had like kicked me in my back or had punched me in my back.
Okay.
Yeah, if I've just had like really strenuous day the day before or something like that.
Now, is there anything that makes it feel better or makes it feel worse?
It actually feels better when I exercise, especially since I started doing yoga.
Yeah, great.
It improves a lot, yeah. Making it feel worse is if I have to like stand for a very long time or sit for a very long time. I have to change my position a lot.
Okay, so when you're pretty stationary, that's when your muscles kind of go into a bit of a spasm or lockdown, shall we say.
Yeah.
And that's when you start feeling the ache. It doesn't shoot, or there's any numbness or anything that goes along with it. Is it just kind of a general ache that's happening?
There's a little bit of numbness, but never at my back.
Okay, where?
It's always just in my fingers, in my hands.
Okay.
Yeah, sometimes in my elbows.
Okay.
Yeah.
You were never in a car accident?
I was actually hit by a car.
Okay,
Yeah.
when was that?
In 2009.
2009.
Yeah. So it was 10 years ago, and I had like some physio after and massage therapy, and we thought it was resolved, and then it came back really bad 5 years ago.
Okay. And have you had any treatment since then, in these past 5 years?
In the last year, I've been seeing an osteopath, and it like completely changed my life. Before, I wasn't even touching my toes, and
Right.
now I'm a lot more flexible. It's just more like living with the pain, trying to reduce the back pain a little bit.
Okay. Have you had any soft tissue therapy?
I've had some massages, yeah. So I came to London. I used to live in Canada.
Mm-hmm.
And when I was,
Fellow Canadian, folks. Fellow Canadian.
And yeah, when I was back home, I was seeing a massage therapist for like 1 year.
Yes. And did that?
Oh yeah, worlds of difference. Worlds
Yes.
of difference.
Okay.
Yeah, and I was looking for something similar here, but then I ended up finding an osteopath who I really liked, so I stayed with her.
Okay.
Mm-hmm.
Right. Would you be open to having soft tissue therapy here?
Oh,
if
yeah.
you could integrate the osteopath and the soft tissue therapy, because they really work well together.
Oh yeah, they do.
And
yeah.
your yoga is, are you doing that now?
Yeah, I am.
Okay.
Yeah.
So when the car hit you, you were walking?
Oh yeah, I was crossing a street.
You're crossing the street.
Yeah.
Wonderful. So he hit you from the side?
Yes, he hit my right side.
Right.
He hit my right side.
Did
yeah.
you travel distance?
I did. I went from the middle of the road to the other, back onto the sidewalk.
Wow.
So it was quite far, actually.
Wow.
Yeah.
Did you suffer any concussions or broken bones or anything?
I was lucky for that. So at that time, I got a head injury.
Yeah.
But it like nothing was broken.
Yeah.
And just like blood collected in different parts of my body.
Yeah.
I had a lot of bruising, a hematoma, and things like that. But nothing that needed surgery.
When you said you had a head injury, what was that?
So the back of my head was all was hit there, and there's a lot of bruising there. So now I have like neck spine problems, and it's probably because of that.
Okay. Righto. Do you have anything else that you would like to share with me with regards to your body, other than the back and the neck and the...
Funny enough, I got a tendonitis last week.
Mm-hmm.
So this is my first day without crutches in like a week.
Oh, wow.
Yeah.
Yeah. Where's the tendonitis?
It's in my foot.
Okay.
So it was one of the tendons that go from like your shin to your foot.
Okay.
Yeah, to the baby toe.
So it's in the leg, in other words. It's coming
Yeah.
from here down to the baby toe, is it?
But the only place I really feel the pain is on the side of my foot and on the bottom of my foot.
Okay.
Yeah, but it's resolved a lot. Before I wasn't even walking.
Okay.
Yeah.
So how did you resolve it?
Just rest, ice, compression, elevation.
Okay. All right.
Typical
Okay.
stuff.
Yep.
Yeah,
Okay.
so just lots of ice. I have a compression band on it right now.
Yeah.
And just been keeping it up,
Okay.
going crazy, doing nothing at home.
Okay, most of you might know, well, many of you might know that I'm not the right ice compression elevation woman. I do believe that ice has an element of effectiveness for pain, but not in the reduction of inflammation, and none of the other things have actually been proven to support the outcome that it helps, it actually resolve the issue. But generally, I'm more the mobility person, so I like the idea that there's still some movement happening, but a lessening. So in other words, you're not putting it through its normal full stress, but that there's an element of movement. And we'll look at things. So do you remember how that happened, or is it just a gradual thing, or was it sudden?
It was sudden for me. I had a little bit of foot pain.
Yeah.
And then I woke up and couldn't walk.
Right.
Yeah.
Okay.
And it's typically like a runner's injury, and I ran quite a bit. So.
Okay. How far do you run?
Probably about 6 miles.
How often?
2 times a week.
2 times a week.
Yeah, but
okay.
in between I might do other kind of like running activities. Like I ran for when I trained with boxing and.
Right. What else do you do?
And yeah, well, I like do dance and I do boxing and I run. I recently just started a ballet class, so maybe that's what put it over the edge.
Maybe, yeah. Okay, fair enough. Yeah, well, let's see what happens. I'm going to do an assessment. Generally, just kind of get a sense of how your body is moving. and maybe some suggestions. So I'll take you through my thoughts. As I'm doing things, I will express what I'm finding, and then you can take it away and do what you may with it.
Okay.
Okay. Thank you for joining me. Now, if you have any comments, please do leave them below. I might not get the right away, but certainly we'll get to them as soon as possible. If you liked it, please do indicate that you did. And if you want to share it, I welcome you to do so. Otherwise, I hope to see you in other vids. And until then,